Like Jennifer said, my name is Rafael Roman, and we're going to be going over today the diversity of the pharmacy workforce. So I'm going to begin with the simple question. How do we gauge diversity? Is it through trends, by evaluating different industries and comparing standards? Or is it measured by intended goals set by institutions? For today, we'll be comparing our workforce diversity by the National Diversity Average. So thanks to the US Census Bureau, they provided us information from racial diversity of the general population. So we're going to take a look at race and the national average percentage. So for Caucasians, it's 76%. For African Americans, it's 13%. For American Indians and Alaskan Natives, it's 1%. For Asians, 6%. Native Hawaiians and other Pacific Islanders, less than 1%. And for Hispanics or Latinos, 19%. Now, going forward, we're going to be focusing our attention on African Americans, Asians, and Hispanics or Latinos nationals average versus pharmacists and pharmacy technicians workforces. So we're going to take a look at pharmacists first. So thanks to the American Association of Colleges of Pharmacy and their National Pharmacist Workforce Study in 2019, this organization was able to collect racial data from both practicing and non-practicing pharmacists. So let's take a look at those numbers. Pharmacists that identified as African American fell below the national average. Pharmacists that identified as Asian was above the national average. For pharmacists that identified as other, which was Hispanic, Latino, and or other, fell well below the national average. Now, with that said, we have an idea of what the national average is for pharmacists and for pharmacists based on this data. Let's look at my profession, pharmacy technicians. So based on data collected by the NPTA, the National Pharmacy Technician Association, and the PTCB, Pharmacy Technician Certification Board, we'll be able to compare the pharmacy technicians workforce in depth. So for pharmacy technicians that identified as African American, we see that we fall very close to the national average. Close, but not just there yet. When it came to pharmacy technicians that identified as Asian, we see that it's above the national average. For pharmacy technicians that identified as Hispanic or Latino, we see that we fall well below the national average. Now let's stop for a moment and think and process all this as a whole. Why does this data matter? What does a diverse pharmacy workforce even mean for pharmacy professionals and our patients? Well, our friends at the ASHP provide us with that answer. So ASHP, the American Society of Health System Pharmacists, provided us with recommendations on what a pharmacist's role can do to eliminating disparities in our communities. Such recommendations consisted of increase awareness of disparities. By increasing awareness of racial and ethnic disparities, we begin to acknowledge that there is a problem. To create a more diverse healthcare workforce, this can improve access to care for racial and ethnic minority patients. Promoting cultural competent care and services. The more competent we become of other cultures, we become more knowledgeable about cultural differences and their impact on attitudes and behaviors. We then become sensitive, understanding, non-judgmental, and respectful of cultures different than our own. We then become flexible and skillful in responding and adapting to different cultural contexts and circumstances. Next is ensuring effective communication with patients among providers. That's providing translated materials for all demographics and translation services. Utilizing multidisciplinary teams and evidence-based guidelines to better treat our patients as a whole. Collecting and monitoring data on health disparities and formulating a standardized collection of data is key, as we've seen in the previous slides. And last but not least, research and disparities in healthcare. Researching, identifying, disseminating best practices for providing cultural competent care and reducing disparities in healthcare. These are all great recommendations, But who else in the pharmacy ethos has additional resources? On June 5th, 2020, the following organizations pledged to make a stance on racial injustice. Their pledge was loud and clear. They pledged the unity to advocate for a dismantling of systems that have historically marginalized and oppressed Black Americans in this country. They stood to advocate against police brutality and law enforcement misconduct, advocating to measure and eliminate inequities resulting from racism and discrimination in every facet of our profession, including patient care and several additional platforms. And lastly, and most important, advocating for health equity in marginalized communities to eliminate disproportionate health outcomes. This, ladies and gentlemen, was a momentous moment. To have 14 organizations that shape the foundation of our profession come together and say enough is enough. We must stand united and stop racial injustice is huge. If there's any additional resources or information you may need, look no further than to them. With that said, I thank you so much for your time, and let's turn our attention